It is so important to have standards and regulations for body art.
The value in these standards is that everyone, practitioners, business owners, and public health officials, know what the minimum requirements are in a body art facility. If we have regulations, then there's a starting point where business owners can develop their operations and inspectors know what's enforceable.
It is a high-risk industry, and that's not just saying it's high risk for the public and the patrons of the industry, but it's also a high risk for the artists themselves.
We're still in the pioneering phases of body art regulations, still in the pioneering phases of understanding the industry. And even though in a lot of places in America, it's body art is part of their culture, it's not in other places. So we need to share our knowledge, have regulations, and allow people to be able to do their jobs.
We want to hope that industry is able to use common sense and is well trained enough to understand why we are super strict about first aid and bloodborne pathogens.
At the end of the day, if an inspector or a body artist doesn't know how to do their job safely, they can't keep the community they work in safe. So regulation and standards help to protect that safety.
I think a training program for inspectors is important.
We ask them to do many tasks. They don't just inspect body art studios, they inspect restaurants and wells and so many other things, pools. And they get specific training for those industries because there's a lot to know, and there's a lot to know in the body art industry, and it's time that the inspectors get the appropriate training so they can properly handle the inspections.
Oh my gosh, I think this is one of the most important things that we need to address in this line of work right now. There's so much training available for food safety and for on-site wastewater treatment and for air quality and many of the other programs that we do as environmental health specialists, but there's nothing for body art.
You should be able to go to a restaurant and expect your food to be safe for you and your family to consume. You should be able to go and get drinking water from a public source, and it should be safe for you to consume. And you should be able to go and get a piece of body art, and it should be a safe environment for you to do so in.
A lot of body art practitioners have a real lack of understanding of disease transmission.
My first tattoo was done with somebody not wearing gloves. That alone. Hand washing is the number one step. Having regulations come in to understand why we wash our hands the way we do, why we wear the type of gloves that we do, how to don them, all the way over to your setup, how you run sterilization, understanding your equipment. All of this is positive, and those are just the beginning stages.
The earliest body art practitioners were at a particular risk to the common bloodborne pathogens because they worked in times without guidance and information, technology, and enforcement.
The biggest changes that I have seen in body art regulations goes towards the ability of areas and departments to regulate the industry.
I've seen an increase in the number of organizations and departments who included qualified practitioners in their professional events and in developing their training programs, and a great interest in continued education for both body art practitioners and inspectors.
It's been very pushed to the side as a program in environmental health because it's not super mainstream, but as it's becoming more and more mainstream, the need has arisen and more people are on board and more people are asking questions.
The impact that this industry is having on the community is high because you are having such a large amount of the community going and partaking in this form of art.
More practitioners are accepting that compliance is necessary, and I've also seen inspectors have a new willingness to learn about the different ways that body art studios operate, and I think that's really exciting.
It's hard to build that rapport. It's hard to gain that trust, and I think that's the most important thing to prevent those misconceptions.
And I think body artists have gotten to the point where we trust our public health inspectors and officials and are ready to work with them, and they are hopefully ready to work with us.